Everyone, hope you're doing great today. Hey, today we are starting out with chapter 9. I know it's not chapter 1, it's a little bit out of sync, but I just felt like this was a good place to start. We're going to be talking about client consultation and health appraisal. So here we go. So our objectives are that you be able to conduct an initial client interview to assess compatibility and develop goals and establish a client personal trainer agreement. Be able to understand the process of a pre-participation health appraisal screening, and be able to identify positive coronary risk factors associated with cardiovascular disease, as well as to evaluate and stratify the health status of potential clients, and recognize individuals requiring referral to healthcare professionals. It's really important that you understand that you may not be able to help everyone, but be able to give them access to someone who can help them. So, a consultation involves discussing the health concerns, symptoms, medical history, and any other relevant information of your client. The purpose is to provide expert advice and guidance. A consultation may also involve discussing some treatment options, lifestyle modifications, preventative measures, or referrals to specialists if necessary. The purpose of the health appraisal, on the other hand, is also known as a health assessment, and it aims to evaluate the overall health status, identify potential risk factors or health issues, and provide recommendations for maintaining or improving your client's well-being. It typically involves a comprehensive evaluation of their medical history and may include other screenings based on their age, gender, and specific risk factors. There is not necessarily a specific standardized process for doing all of this, but there are 4 considerations for implementing the consultation and health appraisal for a personal trainer. First, you want to, of course, go over your credentials as a personal trainer. The personal trainer conducting the consultation and health appraisal, that's you, should possess the necessary qualifications and credentials to assess the client's health and provide personalized training guidance. It should ensure that the trainer is certified by a reputable fitness organization. As we talked about earlier, the National Strength and Conditioning Association is one of those organizations, but there are others. American College of Sports Medicine, as well as NASM, and there are others as well. And that you have relevant expertise in exercise science, anatomy and physiology, and health assessment. The trainer's knowledge and experience are crucial for accurately interpreting client data and designing effective training programs. As far as the site delivery or site of delivery, considering where the consultation health appraisal will take place, it could be conducted in a fitness facility, a dedicated consultation room, or even remotely via video conferencing or on an online platform, as we're starting to see now in the industry. You want to determine the most suitable location based on factors such as privacy, convenience, equipment availability, and the preferences of the trainer and clients. You want to ensure that the chosen site is conducive to conducting assessments and maintaining confidentiality. The specific population that's served. Personal trainers often work with a diverse population, including individuals with different age groups, fitness levels, and specific health considerations. When implementing the consultation and health appraisal, take into account the specific population the trainer serves. Consider modifying assessment tools and questionnaires to capture relevant information for different demographics and tailor the training recommendations accordingly. For instance, assessments for older adults or individuals with medical conditions may require additional considerations. And the legal statutes. You want to ensure compliance with legal statutes and regulations related to personal training. So very soon, one of the statutes that's coming about is accreditation, really looking at the professional organizations. They're going to require that anyone going for a personal training certification has a degree in kinesiology. It's really exciting for our field and kind of gives us a little bit more credence. For ACSM, they're going to be doing that in 3 years versus the NSCA, who will be going to that in 4 years. So having an understanding of that and knowing that you're not going to be competing with those that don't necessarily have a degree any longer. It's going to shut down. It's going to change the field. So have an understanding of that, health assessments, as well as data collection. You want to familiarize yourself with the relevant laws of governing personal trainers in your jurisdiction, regionally, as well as in the state, including privacy regulations, informed consent requirements, and professional liability considerations. You want to adhere to these legal obligations when designing the consultation and health appraisal system to protect both you and the client's rights and ensure ethical and legal practices. So by considering these factors, you can establish a solid foundation for implementing the consultation and health appraisal system that aligns with industry standards, respects legal requirements, and caters to the unique needs of the personal trainer and the clients. Training involves gathering sensitive health information about clients, such as medical history, their fitness goals, and physical limitations. It is crucial to prioritize data privacy and security when implementing a consultation and health appraisal system. Ensure that the system complies with relevant data protection laws and regulations, and implement robust security measures to safeguard client information, such as encryption, access controls, and secure data storage. The National Strength and Conditioning Association provides guidelines for conducting health client consultations and health appraisals in the field of strength and conditioning. The following are the steps recommended by the NSCA. Schedule your interview appointment. And so with this, you're doing your pre-consultation preparation. You're preparing for the consultation by reviewing their intake forms, their medical history, and other relevant information. Set up the necessary equipment and assessment tools that you'll need for that day. In conducting the interview, you want to do an introduction and to help to build rapport. So begin the consultation by introducing yourself and establish rapport with the client. Make them feel comfortable and create an open environment for effective communication. And conduct a comprehensive interview to gather information about their background, their exercise history, their health concerns and goals, and any limitations or contraindications. This interview may involve asking specific questions related to their exercise program, their lifestyle, previous injuries, and health conditions. And then implementing and complete health appraisal forms. You want to evaluate them for coronary risk factors, diagnosed disease, and lifestyle, and review the client's health history form, focusing on any medical conditions, surgeries, medications, allergies, and family history of health issues. Discuss any red flags or areas that require further clarification. And then assessment and interpreting the results. You want to perform a physical assessment to evaluate their overall fitness level, their body composition, and movement patterns. This assessment may include measuring their height, their weight, body compositions via skin fold or bioelectrical impedance, and functional movement screen with the squat assessment or overhead mobility assessment. You conduct the specific fitness assessments to evaluate their strength, endurance, flexibility, and cardiovascular fitness. These assessments may include tests such as the 1RM or 1 repetition maximum for strength, timed runs for cardiovascular fitness, and flexibility tests for range of motion. You want to educate the client about the assessment results, explaining the implications of the findings and how they relate to their goals. Discuss areas of strengths and areas that require improvement, as well as potential risk or consideration, and refer to an allied health professional when necessary. You also want to make sure that you obtain medical clearance and program recommendations from those allied health professionals when you do refer them. And this is just an example of a physician's referral form that you can send out to their doctor. Of course, you can modify it to do whatever you need it to say, but this is from the NSCA's Essentials of Personal Training, the 3rd edition. So it's pretty logical. Initial personal training interview, also known as the client consultation, is a crucial step in the personal training process. It involves gathering information about the client, establishing rapport, and setting the foundation for a successful training relationship. Here are some key components typically involved in the initial personal training interview. You want to assess compatibility. Begin by introducing yourself and creating a friendly, welcoming atmosphere. Engage in small talk to build rapport and help the client feel comfortable sharing information. Personal trainers typically provide a range of services to their clients, and it's important for them to clearly communicate the aspects of their services. Additionally, they assess the individual's exercise readiness, evaluate suitability and appropriateness, and consider their own education and experience, certifications, and expertise. And so here's a breakdown of those aspects. So your services that you provide, you should clearly outline the services that you offer. They may include one-on-one training sessions, group training, online coaching, nutritional guidance, exercise programming, goal setting, progress tracking, and lifestyle recommendations. Now, when I say nutritional guidance, you do want to be very careful with that. You want to make sure that you're not overstepping your bounds. You do not have a degree in nutrition. It is an exercise science. And so that requires getting a master's or other certifications that allow you to do that. So you want to be really, really careful with overstepping your boundaries there. As I was saying, maybe you offer exercise programming, goal setting, progress tracking, and lifestyle recommendations. They may also offer specialized services such as sports-specific training, injury rehabilitation, or weight management. Your education experience, certifications, and expertise. So personal trainers should communicate their educational background, such as degrees or certifications related to exercise science, kinesiology, or personal training. They also should highlight your experience in the field, including the number of years that you've been working as a personal trainer and any specialized expertise that you've developed. Additionally, certifications from recognized organizations validate your knowledge and skills. In assessing exercise readiness, personal trainers conduct an assessment to determine an individual's exercise readiness. This assessment may involve gathering information about their health history, their current fitness level, previous exercise experience, and any limitations or medical conditions. By understanding the client's exercise readiness, trainers can tailor the training program to their specific needs and capabilities. And suitability and appropriateness. Personal trainers evaluate the suitability and appropriateness of their services for each individual. They consider factors such as the client's goals, preferences, availability, lifestyle, and any specific considerations or limitations. That evaluation ensures that the training program aligns with the client's needs and increases the chances of success and adherence. By considering these aspects, personal trainers can provide comprehensive services that are tailored to the individual's needs, abilities, and goals. It also allows them to showcase their qualifications and expertise and ensure a safe and effective training experience for their clients. The client background and goals. Ask the client about their background, including their occupation, their lifestyle, their exercise history, and any previous experience with personal training. Inquire about their motivations for seeking a personal trainer and discuss their specific fitness goals by both short-term as well as long-term. And as far as goal setting, you want to collaboratively establish specific, measurable, attainable, relevant, and time-bound or SMART goals with the client. Ensure that the goals align with their aspirations, abilities, and limitations identified during the assessment. Personal trainer agreement, also known as a training contract or service agreement, is an important document that establishes the terms and conditions of the working relationship between the client and the trainer. While the specific details may vary, here are some key elements to include in the agreement. So the parties involved, you want to clearly state the names and contact information of both the client and the personal trainer. The services that are provided, you want to describe the specific services that you will be providing, such as fitness assessments, exercise programming, any additional services that you've agreed upon. The goals and expectations. Outline the client's fitness goals and expectations for both the client and the personal trainer. And that should include attendance, adherence to the program, commitment to nutritional guidelines, and again, mutual communication expectations. You want to establish the client personal trainer fitness facility agreement as well. So with that, you're considering where you will be training. And so again, what are the services that are provided? Describe specifically what you will be providing at the fitness facility, such as one-on-one training sessions or group classes, and where those happen, or any other training programs that you might have. What kind of facility access will this person have? So you want to specify the access to the fitness facility during the training session, including any restrictions or limitations based on facility policies or operating hours. It varies based on employment status of the personal trainer, whether they are self-employed, independent contractor, or an employee of the facility, as to what that looks like. There are some facilities that have 24 hours that you can go in. You just swipe your card and you're in. So you want to make sure that you outline that very well. The schedule and frequency, you want to outline the agreed upon schedule for training sessions at the fitness facility, including the duration and frequency of sessions, and address any rescheduling or cancellation policies specific to the facility. Their membership or usage fees. Clearly state the fees and payment terms associated with using the fitness facility. That may be in addition to the personal training fees. And specify whether the personal training fees are separate from that facility membership fee or if they're bundled together. The facility rules and regulations. You want to incorporate the rules and regulations of the fitness facility that the client and the personal trainer must adhere to during training sessions. That may include policies regarding safety, hygiene, equipment usage, dress code, and code of conduct. Schedule and frequency. So specify the agreed upon schedule for training sessions, including the duration and frequency of sessions. Address any rescheduling or cancellation policies. And payment terms. Clearly state the fees, payment methods, and billing cycle for the personal training services. You want to include information on any additional costs, such as assessments or materials, and whether payments are refundable or not. The duration and termination. So specify the duration of the agreement and any termination conditions. This may include notice periods for termination by either party and any associated fees or penalties. Confidentiality and data protection. You want to address confidentiality and privacy of client information, ensuring compliance with applicable data protection laws. Establish how client information will be stored, used, and shared. And liability and waiver. You want to include a liability waiver clause to acknowledge and accept the risks associated with physical exercise. Clearly state that the client assumes all risks and releases the personal trainer from liability for any injuries or damages that may occur during training sessions. Dispute resolution. You should also include a clause outlining the process for resolving disputes or disagreements between the client and the personal trainer. This may involve mediation or arbitration. And governing law. Specify the governing law that will apply to the agreement, outlining the jurisdiction in any case of any legal disputes. And then your signatures. You should include spaces for both your signature as well as the client to sign and date the agreement. This signifies their acceptance and understanding of the terms and conditions outlined, much like the syllabus. Remember, it's essential to consult with a legal professional or seek appropriate guidance to ensure that the client personal trainer agreement complies with local laws and regulations. This helps protect both parties' rights and sets clear expectations for a successful and professional working relationship. I would also recommend that you have a lawyer look over your agreement, make sure that it says exactly what it needs to say. You could have them help draw it up if you like. Participation health appraisal screening is an essential component of client consultation in the fitness and personal training industry. It involves gathering comprehensive information about the client's health status, medical history, and lifestyle factors to assess their readiness for exercise and identify any potential risk or contraindications. identification of known diseases and risk factors associated with cardiovascular disease, assess lifestyle factors that may require special considerations, and identify individuals who may require medical referral before starting an exercise program. So here are the key steps involved in pre-participation health appraisal screening during client consultation. The client completes a relevant intake forms and questionnaires. So you will be providing the client with intake forms and questionnaires that capture essential information about their medical history, previous injuries, their current health status, lifestyle habits, and exercise goals. These forms may include sections related to personal information, medical conditions, medications, allergies, previous surgeries, family history, and lifestyle factors like smoking or alcohol consumption. You want to review their medical history and evaluate coronary risk factors, disease, and lifestyle. Thoroughly review the client's completed intake forms, paying attention to any medical conditions, injuries, or surgeries they have disclosed, and look for red flags or indications of health issues that may require further investigation or medical clearance. Risk stratification. You want to use risk stratification tools such as the American College of Sports Medicine Guidelines, or ACSM, to determine the client's risk level for cardiovascular events during exercise. This helps identify clients who may need additional medical clearance or further evaluation before engaging in exercise. Physical examination, if it's applicable, you're depending on the scope of your practice and qualifications, you may perform a basic physical examination to assess their general health markers such as blood pressure or resting heart rate, body composition, and overall physical condition. Note any abnormalities or potential concerns that may require attention and be able to interpret the results. And medical clearance, if necessary. If the client has disclosed significant medical conditions, is at high risk according to the risk stratification process, or if you have any concerns based on the information provided, it may be necessary to refer the client to a health professional for further evaluation and medical clearance. This ensures that exercise is safe and appropriate for their specific situation. Communication and collaboration. If additional medical clearance is required, establish clear communication channels with their healthcare professional to exchange information and ensure a collaborative approach to their fitness journey. Obtain necessary consent from the client to communicate with their healthcare provider. And risk communication and informed consent. You want to clearly communicate any identified risk, contraindications, or precautions to the client, ensuring they understand the implications and potential consequences. Discuss the importance of disclosing any changes in their health status during the training process and obtain their informed consent to proceed with exercise. And program modification and adaptation. Based on the information gathered during the pre-participation health appraisal screen, modify and adapt the training program as necessary to accommodate any limitations, precautions, or specific needs of the client. You want to consider their medical history, their risk factors, and goals to design a safe and effective exercise plan. And remember, the pre-participation health appraisal screening process is critical to ensuring the client's safety and optimizing the effectiveness of their training program. It establishes that foundation of understanding their health status and enables you to provide appropriate guidance and support through their fitness journey. The Physical Activity Readiness Questionnaire for Everyone, the PAR-Q Plus, is a widely used pre-participation health appraisal screening tool that assesses an individual's readiness for physical activity and exercise. It helps identify any underlying health issues or risks that may require further evaluation or medical clearance before engaging in exercise. So here are some sections typically included in the PAR-Q Plus form. Personal information, their name, date of birth, contact information, physical activity readiness questions that typically consist of 7 standard questions aimed at assessing an individual's readiness for physical activity. These questions cover aspects such as known heart problems, chest pain during physical activity, loss of consciousness or dizziness, physician consultation prior to starting exercise, current medications that may affect exercise, and any other medical conditions that may affect their exercise participation. previous injuries or surgeries that may affect exercise, and then additional follow-up questions. Depending on the responses to the initial PAR-Q Plus questions, there may be follow-up questions to gather more information and may address issues like blood pressure levels, diabetes or blood pressure management, joint or bone problems, breathing difficulties, epilepsy or seizures, and emergency contact information. So name and contact of an emergency contact person. The PAR-Q Plus form is designed to be simple and efficient, allowing individuals to quickly assess their readiness for physical activity. If a person answers yes to any of the questions or provides additional relevant information, it may indicate the need for further medical evaluation or clearance before initiating an exercise program. As a personal trainer, you should review the PAR-Q Plus form with the client during the consultation process. Ensure they understand the questions and encourage them to provide accurate information. This form helps guide the decision-making process regarding exercise programming and ensures the client's safety throughout their training journey. And this is just an example of what the 2023 PAR-Q Plus form looks like. You've got page 1 and page 2, page 3 and 4. This is something that this is an assignment for this week. You will be you'll be completing the PAR-Q form as well. And so you'll need to make sure that you're reading it very carefully, and then you'll make sure to sign it at the bottom. This is an example of a health and medical questionnaire. You can see it's got activity history as well as family history and present and past history. In addition to the PAR-Q Plus questionnaire, there are several other screening tools and assessments that can be included in the client consultation process for pre-participation health appraisal screening. These additional screenings help gather more detailed information about the client's health, fitness level, and potential risk factors. Here are some examples of additional screening components that can be incorporated. The lifestyle and physical activity assessment, so a detailed questionnaire about the client's current physical activity levels, their exercise habits, and sedentary behaviors. Questions related to occupational activity, their hobbies, their recreational activities, and daily movement patterns. Information on the client's exercise preferences, their barriers to physical activity, and motivation for seeking personal training. A health history and medical questionnaire, like we just saw, that is a comprehensive questionnaire that goes into further detail about their medical history, specific conditions, surgeries, hospitalizations, or chronic diseases, and additional questions about specific symptoms or limitations related to cardiovascular, pulmonary, metabolic, or musculoskeletal health. Gathering information on allergies, medications, and previous examples with exercise-related complications. And then fitness assessments. Measurements of body composition, including weight, height, body mass index, waist circumference, or skin fold measurements. Assessment of cardiovascular fitness through tests like submaximal or maximal exercise testing, such as the 1 mile walk test or the 3-minute step test or treadmill stress test. An evaluation of muscular strength and endurance using tests like push-ups, sit-ups, or grip strength measurements. And flexibility assessment through tests like the sit-in and reach test or shoulder flexibility measurements. And a functional movement assessment, so assessing movement patterns, balance, and stability through functional movement tests such as the squat lunge or overhead reach to identify any asymmetries or limitations, and screening for any movement compensations or dysfunctional movement patterns that may increase the risk of injury during exercise. Nutritional assessment, so you're gathering information about their dietary habits, nutritional goals, and any specific dietary restrictions or preferences, and assessing their client's understanding of basic nutrition principles, hydration practices, and potential nutritional deficiencies. Any additional medical evaluation, you want to refer the client to a healthcare professional for further evaluation if there are any red flags or concerns during that screening process. And then work in collaboration with them to obtain medical clearance to address specific health considerations. The informed consent, as we've talked about, you want to get consent for participation in exercise training and programs and acknowledge any potential risks and benefits of exercise. An agreement to disclose any changes in their health status or new medical conditions as well. So by incorporating these additional screening components, personal trainers can gather a comprehensive picture of their client's health, fitness level, and specific needs. That information helps you in developing a tailored and safe exercise program that addresses their goals and limitations while minimizing risks of potential complications. And this is just an example of, again, some screening tools that you can use. This is looking at cardiovascular disease, risk factors, and health habits. The assumption of risk or waiver is a legal document that is often included as a part of the client consultation process in the fitness industry. It is intended to inform clients about the potential risks associated with participating in physical activities, including exercise and personal training, and to have clients acknowledge and accept those risks before engaging in such activities. Here are some key points to consider when including an assumption of risk or waiver. The purpose is designed to inform clients about the inherent risks involved in physical activities and to ensure that they understand and accept those risks voluntarily. The content, the document should clearly state that participating in physical activities, including exercise and personal training, carries inherent risks, such as the risk of injury, illness, or even death. It should specify that clients are assuming those risks voluntarily and without coercion. And the explanation of risk. So assumption of risk or waiver should provide a general explanation of the specific risks involved in physical activities. This may include risks related to the use of equipment, the potential for accidents or falls, the strain on muscles and joints, and the potential for overexertion. A release of liability this document should include this clause stating the clients release the personal trainer or the fitness facility and any affiliated individuals or entities from any liability for injuries, damages, or losses that may occur as a result of participating in physical activities. Voluntary participation. It should be emphasized that participation in physical activities is voluntary and that clients have the right to refuse or modify any activity that they deem unsafe or uncomfortable. And clear and understandable language. The assumption of risk or waiver should be written in clear and understandable language, avoiding complex legal jargon. Clients should have the opportunity to review and ask questions about the document before signing it. And the signature and date. So clients should sign and date the assumption of risk or waiver to indicate their understanding, acceptance, and agreement to the terms and conditions stated in the document. Of course, there's a consideration of local laws and regulations. It's important to consult with legal professionals to ensure the assumption of risk or waiver complies with local laws, regulations, and industry standards. The enforceability of such documents can vary depending on jurisdiction. While an assumption of risk or waiver is a common practice in the fitness industry, it's important to note that it may not absolve a personal trainer or fitness facility from all forms of negligence. It is crucial to maintain a safe training environment, adhere to professional standards, and provide appropriate instruction and supervision to minimize the risks associated with physical activities. When working with children in fitness or personal training setting, additional considerations need to be taken into account to ensure their safety and well-being. So making sure that you have parental consent form. This form is essential to obtain consent for the child's participation in the fitness or personal training program. It should include the child's name, age, and contact information, as well as the parent or guardian's contact information and signature. And similar to adult pre-participation forms, this document gathers information about the child's medical history, allergies, previous injuries, and any medical conditions that may impact their participation in physical activities. It should also include emergency contact information and any relevant medical insurance details. The parent-guardian interview. You want to conduct an interview with the parent or guardian to gather additional information about their health, the child's health, developmental stage, physical abilities, and any specific concerns or goals related to their pre-participation in the fitness program. And similar to adult waivers, this document informs parents or guardians about the potential risks involved in physical activities for children and ensures they understand and accept those risks on behalf of their children. It may include a release of liability clause and an acknowledgement of the child's voluntary participation. And code of conduct and policies outline expectations, rules, and policies for children and their parents or guardians while participating in the fitness or personal training program. This may include behavior expectations, dress code, equipment usage guidelines, and communication protocols. As well as you want to make sure you get a privacy and media release form from the parents or guardians for the use of the child's name, likeness, or photographs for promotional or educational purposes. Clearly outline the child's privacy will be protected and how their information will be used. An emergency medical authorization. So if something happens, this form grants permission to seek medical treatment and an emergency medical care for the child if necessary. It should include information about any known allergies or medical conditions and provide contact details for the child's primary healthcare provider. And program agreement. So you want to outline the terms and conditions of the fitness or personal training program, including session schedules, fees, cancellation policies, and any other specific requirements or expectations. And remember to ensure all pre-participation documents for children are written in clear and concise language, taking into account their age and comprehension level. It also important to communicate openly and effectively with their parents or guardians, addressing any questions or concerns they may have regarding their participation in the program. Record keeping is an essential aspect of client management, and it is crucial for personal trainers to maintain accurate and organized information about their clients. You want to develop a strategy to collect, organize, and store the vital information and materials obtained through the interview process. So here are some key points to consider. Your client information, so maintaining record of their personal information, and you want to also ensure effective communication, and it enables you to address any specific needs or considerations. Follow HIPAA, the Health Insurance Portability and Accountability Act protocols, to ensure confidentiality and integrity of the client-personal trainer relationship. Your health and fitness assessments, you want to keep a record of those conducted during the process and regularly update these records to track progress and evaluate the effectiveness of the training program. Their exercise programming, so document the training programs designed for each client, including the exercise prescribed sets, reps, intensity, and modifications or progressions made over time. This allows you to track their progress and make informed adjustments and ensure a systematic and progressive approach to their training. And session notes. Take detailed session notes after each training session, highlighting the exercises performed, client performance and technique, any challenges or concerns raised by the client, and any adjustments made during the session. These notes serve as a reference for future sessions, helping you track progress, identify patterns, and tailor future sessions accordingly. Communication and correspondence. You want to keep records of all communication and correspondence with clients, including emails, text messages, and phone conversations. This helps maintain a clear history of discussions, their requests, and any important information shared, as well as informed consent and waivers. That provides proof of a client acknowledgement and acceptance of associated risks and terms. And privacy and confidentiality, ensuring that their client records are securely stored and comply with privacy and data protection laws. So you want to take appropriate measures to safeguard their information and obtain consent for storage and use of their personal data. And keep records of financial transactions, including invoices, receipts, and payment history. Additional, maintain records related to any legal agreements or contracts or cancellations. And regularly review and update client records as needed. Establish a system of retaining records in accordance with legal requirements and industry standards. Determine the appropriate length of time to retain records and ensure they're secure disposable when no longer needed. Effective record keeping not only helps you deliver personalized, safe training programs, but also ensures professionalism, accountability, and client satisfaction. It enables you to track client progress and identify trends and make informed decisions to enhance the overall training process.